Well, from teens to toddlers, pediatrician Dr. Sunderbruch is here to answer some of the questions you sent in on autism. And it's a very sad but very relevant topic because, Dr. Sunderbruch, are more and more children being diagnosed with autism?
Yes, more children are being diagnosed with autism than we've ever seen before. But what we don't really know now is, are truly there more children with autism, or are we just so much better at identifying it now and treating children that much more children are getting the help that they need?
Did they just maybe call it something else in the past?
Well, of course, if you think back to, when I was growing up, or, when you guys were younger, we had lots of unfortunate names for people who were different, who are developmentally challenged. And we didn't call it autism, we, called it all sorts of other things. Yeah. But now, thankfully, we have better diagnostic tools and are able to identify kids better and really get them the therapy sooner, which is what they need to make big strides.
Well, I have my own unfounded theory. And that's that, when I look at autistic kids now, and I think of my childhood, I remember some kids being different, but I don't remember many kids acting like that. I'm guessing that there's more kids with autism now. So to get to that, we talk about vaccinations.
And we have to do the link, the autism vaccination
we have to do the link. I know that, certainly the American Academy of Pediatrics endorses all vaccinations, is not at this point giving any insinuation that one has anything to do with the other. But vaccines are suspended in some pretty weird things. I mean, like formaldehyde and mercury. First of all, talk about what actually is a vaccination. We know we take it to prevent whatever. What's in that thing that we're taking?
Well, most vaccines take some part of a bacteria or a virus, some sort of core part of it that is enough that your body will have an immune reaction to it, but not so much that it's going to cause you to have that disease. They introduce that into the body. The body's immune system sees that, identifies it, and is then able to fight it off better when it is actually exposed to the natural or wild type of illness.
Okay, those are all the upsides. Now let's talk about the other thing, is that this virus or bacteria has to be kept stable somehow into the bloodstream, and that's done suspended in metals and things like formaldehyde, right?
True. They do add all sorts of preservatives and infective agents to keep the actual fluid that the vaccine is in from becoming, colonized with bacteria or things like that. And obviously they have to keep it active and stable from the place where it's made out into the pediatricians or, family doctors' offices to be given to children.
Well, and I think, to be fair, Shirley, I think the cost-benefit analysis on vaccinations, that the benefits have outweighed the cost through time. But let me just ask you, on this whole autism vaccination thing, do you see a link? Do you see a possible link?
I go off of what the science says. And what the science says is that at this time, we can't find any link between autism and vaccines of any kind. More specifically with the thimerosal preservative, which was the original scare that was brought up in the early 1990s as the possible vaccine autism link.
And they actually are taking well, you said they have taken the thimerosal out, and we haven't seen a decrease in autism.
True. Unfortunately, since 2002, thimerosal has been eliminated from the United States vaccine supply. And in the 5 years since that has happened, we've had the start of a new generation of children. Unfortunately, in those kids, we haven't seen the expected drop in autism that we would hope for if thimerosal was actually a causative link there.
Well, my daughter happens to be, non-traditional. She does not believe, she's scared to vaccinate her children, and she homeschools. But of course, to go into the public school system, you're required to have vaccinations. If we suddenly they proved something, and a lot of parents decided to not have vaccinations, would the risks of that and the downside of that, I mean, like with new epidemics, would it just be catastrophic, or what are the ramifications of that?
It could be, near catastrophic. Vaccines are one of the things that really holds the public health system together, and have had some great vaccine success stories, even in, your lifetime and mine. Smallpox has been eliminated from the world. Right. Polio virus has been eliminated from the entire Western Hemisphere, and that's just in one generation. And the thought that some of these vaccine-preventable illnesses would come back and not only kill children, but start killing adolescents and adults as well, it really could not only be a cost prohibitive factor and be an extreme strain on the U.S. healthcare system, but just generally on a national mentality could really be, damaging to us.
And I don't see that coming anytime soon. It's too cataclysmic of a paradigm shift. Two more things we'd like to touch on. We got about 2 minutes left. One is acne, and the other one is childhood cancers. Acne, I know that in being in the supplement industry, I have seen a lot of natural practitioners treat acne by treating the liver. And acne is primarily treated with dermatologists and pediatricians by things like tetracycline, but or topical applications. What do you think the tie-in, if any, is there to infiltrated blood? In other words, cleansing the liver, having to do with clearing up acne. Do you see any tie-in there?
I'm not aware of any, studies that are directly linked the two. I'd certainly be, open to hearing about them because it is something that pediatricians do deal with on a daily basis. But really, acne is something that we have great, safe, effective therapies, almost always topical, so nothing that has to go through the body's bloodstream or through the system. So I would stress any family that has challenges with acne, talk to your doctor. Certainly no kid should be, getting scars from acne because we do have really safe, effective therapies.
And one question from our viewer is that, is there a way that they can treat it effectively without giving them drugs or anything like that? I mean, if finances are an issue?
Yeah, certainly good skin care is the start to it all. Protecting the skin from the sun, cleansing the skin with a light, natural cleanser that doesn't have too many drying chemicals in it. And then using light moisturizers to prevent the skin from getting over dry and over damaged can really, treat a lot of the baseline problems.
Okay. Well, Dr. Sunderbruch, could you just get a real quick synopsis? Childhood cancers are really coming along phenomenally with treating them. And with a message of hope today.
Yeah.
Yeah, certainly, the field of pediatrics is so rewarding because there are things, both small diseases and large diseases like childhood cancers, which used to kill kids, only 5-10 years ago, that now we see kids overcoming them and leading on to have their own children in the future.
And that must make it a great profession for you.
That's the best part.
Well, remember to email us your health questions to balancedhealth@tln.com. And for more information on asthma or autism, visit tln.com and click on Balanced Health. We'll be right back with your healthy habit of the day, so don't go away.